Hello, my name is Lexi Button, and today we're going to be talking about attention deficit disorder and attention deficit hyperactivity disorder, or ADD ADHD. Signs and symptoms. The top 3 signs and symptoms are inattention, impulsivity, and hyperactivity. Inattention can be anything from not being able to focus to being very sporadic with your thoughts. Impulsivity is not being able to process the consequences of an action before doing the action. Hyperactivity is not being able to sit in one spot for a very long time or talking a whole lot when you should not be. Boy symptoms are usually seen first in girls, before girls, and this plays a role in the statistic that boys are more likely to get the disorder, but they are not. It is just because their symptoms are not overlooked in early years of their life. Diagnostic. Here's where we talk more about the boy and the girl thing. First, there is not one exam or procedure that can be done by a doctor to determine if the child has ADD, ADHD. They have to do a full body scan, which includes your eyes and ears, and then they must do a brain scan to test the brain waves, and then they have to do interviews with the adults in the child's life, and that is only because these adults know the child the best. They know their inattention, impulsivity, and hyperactivity tendencies, and those are the 3 symptoms. Those are the top 3 symptoms that the doctor needs to know about to determine if the child has ADD, ADHD. Like I said, boys mainly are diagnosed in childhood. The statistic is almost doubled in boys than it is girls. I believe it's around 12.9 and for boys and around 5.6 for girls. So that's a pretty big jump. And this is because girls tend to internalize these symptoms and create coping mechanisms to help them get through life. Girls are also pinned as chatty or inattentive as normal woman tendencies, and that's why girls tend to not get diagnosed as children. But they do tend to, however, get more diagnosed later in life. Not as many men get diagnosed as men. They get diagnosed as little boys. But girls, it is more common to get diagnosed as a older woman. Causes. It can be brain injury, premature birth, which leads to low birth weight. Environmental factors. These can be things like drugs, tobacco, alcohol, anything that is not good for the baby during pregnancy, and then especially not after birth and really early on in life. And then when we get to genetics, it can be the parent, the grandparent, and if the sibling has it before the other child. That is also a key factor in the doctor determining if the next child may have ADD, ADHD. Because if the older sibling has that gene, then you know what? It's a good possibility the next sibling may have that gene. Treatment. There are behavioral treatments. These children don't usually go for very long. 2 to 5, I believe it's around 61%. And then when we get to ages 6 through 11, that drops to about 51. So they don't go for very long. It's more of a bridging therapy treatment to make sure they get a good transition. And then they take a medicine called methylphenidate, which it is a stimulant medicine that targets the part of the brain that stimulates control and good behavior. Diet, protein breakfast. That makes the medicine last longer. That helps their symptoms depress during the day and during the night. Fruits and veggies are better. This helps their brain turn off since these patients tend to have trouble with that. Fish and nuts, salmon, tuna, anything like that. That's really good to depress their symptoms as well. And prognosis, there is no cure, unfortunately. These patients have symptoms their whole life. Thanks.